Hello dear, welcome to Online Pharmacy. This is you and this is your online pharmacist. So as today's topic is mentioned over your new slide, that is hypertension. As the word indicate hyper, whenever the person is hyper, we say it when it is extremely exhausted or the blood pressure is flushing and it's going to be red appearance, then we cause that the person is hyper. So the same is occur with our blood whenever we are not normal. So what is hypertension? We are discovering in this slide. A hypertension is a great psychological stress. Why we are saying this it is psychological? Because it's directly or indirectly related to brain or causing psychological as well as physiological damages. It is a clinical syndrome and we can divide or study in the different two aspects. The first one is the systolic, in front of you, systolic blood pressure, and a diastolic blood pressure. A systolic blood pressure, whenever your systolic blood pressure is greater than 140 millimeter Hg, means this is an abnormal value or abnormal behavior of your pressure. So whenever it is greater than 140 millimeter of Hg, this millimeter of Hg is a unit of blood pressure. And whenever the diastolic blood pressure, the blood pressure after the heart contracts, after contraction, and this is when the heart contracts and the pressure exerted on the arterial walls. Okay, so this is a systolic pressure. And diastolic blood pressure, whenever this value is exceeding the 90 millimeter of Hg, which is a unit of pressure, we say that a person is suffering from hypertension. Okay, what are the types of hypertensions? Basically we are studying it in two classes. The first one is primary essential hypertension and the second one is secondary hypertension. The another name of primary hypertension is essential hypertension. The word essential indicates it is necessary, either you are doing something special with your diet, with your physique or not, if you are living a normal healthy life, but these all factors affect your blood pressure and leads to hypertension. So that doesn't have any secondary cause, means you do not suffer or you cannot be suffering from any other disease whenever you are getting primary hypertension. Okay, so the primary or essential or the risk factors are these. We are discussing it line by line, though to be linked to genetics. Some concepts and some theories scientifically prove that they are related to genetics, means we are gaining it from our family, from our parents, from our chromosomes, that's X, from either from X or sometimes from Y. So these are genetically proven that might it be linked from genetics. Poor diet, whenever our diet is not rich or sufficient in the components which are required for the control or balance of blood pressure, and contraction and relaxations, means calcium, magnesium, potassium. These ions are required for the contraction, for relaxation. So whenever we are not taking a diet rich in all these, we are suffering from hypertension. Why? Because the contraction and the relaxation of heart is not normal without these. Okay, so and the other factor is lack of exercise. Whenever we are not doing exercise, extremely these rates are high in Asia, South Asia especially. Why? Because in many countries like Pakistan, like any other populated country where the innovations are larger and people are not able to get a correct amount of exercise daily, then they will suffer from hypertension. These different innovations are generating side by side as the population increases. Many other new world states and many other areas and populations are seems to be affected due to the lack of exercise. So what are the risk factors? The first risk factor is age. As the person's age increases, like old people, old man, we are not control their blood pressure values are not back it to the normal. Why? Because it is an age limit factor. Right, your diet as we discussed, physical activity, exercise as we discussed, alcohol. The person which is addicted to alcohol must have hypertension, and this tension can be reduced only by the removal or the control or the uptakes limited whenever so of alcohol. So the person will treat their hypertension by itself. Obesity, Obesity is basically accumulation of excess fat inside the body, which increase your mass and it looks ugly, not too much pretty. But it doesn't mean that you are not pretty. Obesity is a disease you must have to treat. Okay, so as you decrease your obesity, your fat level, your hypertension automatically decreases. Drugs. Whenever a person is taking steroids, other oral contraceptors means the or oral drugs or oral preparations which you are taking orally due to some other diseases or some other side effects to treat, then they causing the receptors to stimulate, and some stimulations cause renin to increase, and this renin increases the blood pressure we discussed in another slide, inshallah. Okay, stress. What is stress? The tension. Which type of tension? Psychological stress. Psychological stress is basically much more high in our days, like corona cases. Whenever we are stuck in our houses, our activities are bounded towards us, our mind is just circulating around here and there, not any far activities present. So stress is very important. And the last one factor is family history. Family history is also very important because we studied that it links to genetics. So, the second hypertension or the secondary hypertension. This secondary hypertension is also a high blood pressure condition, but this is due to the another disease, like if a person is suffering from kidney problem, thyroid problem, illegal drugs such as cocaines and amphetamines. Cocaines means the drug which are going to be, the person is going to be addicted to these by the usage of continuous use of these. Okay, medicines such as birth control pills, cold remedies means the flu, swine flus, and other cold cough tablets or drugs. Birth control pills if a pregnant lady or a lady which is not required any birth, so it may suffer from hypertension. OTC pain relievers, over the counter pain relievers, these are like Dispirine, which is present over the counter. Means over the counter means the drug required without any prescription, without any physician prescription, without any pharmacist recommendation. And the last one is alcohol use. Secondary hypertension can also be produced due to the alcohol use. What is the treatment? The treatments are categorized into very broad spectrum, but we are only categorize it as by name because we are going to discuss in our next series, in which we all discuss effects, side effects, uses, how to treat, doses, and all other aspects which are required for the treatment of hypertension. So you have to learn these drugs for the treatment of hypertension. What thiazole diuretic is the most common in our society, and doctor prescribe this. What can this do? This can eliminate sodium and A positive ions and water, H2O means H positive and OH negative ions from the blood, and reducing the blood volume. Whenever you are separating something from a glass of water, there also decrease in volume can be observed. Similarly in the blood, when these are vessels or these are arteries, whenever we extract this amount of sodium and water from these, the volumes, suppose the volume was there at that time and now it becomes shear, the volume decreases and causing the blood pressure to reduce. So this is the main purpose, or this is the main concept of thiazole diuretics. Beta blockers also decrease your heart rate. Beside the treatment with these drugs, there is another method is or another way is to naturally treat. Naturally treatment is the best treatment ever. So if you are in overweight, you should reduce your weight so you may observe change in your blood pressure. If you are smoker, then quite smoking, then your blood pressure may decrease or reduce to a sufficient level. Eating a healthy diet means the diet which is rich in vitamins, rich in ions, nutrients. Reducing the amount of sodium in your diet means salt reduction. Aerobic exercise means the exercise which is rich in oxygen and carrying oxygen, a large amount of fresh air into your lungs and into your circulation. Limiting alcohol means limit alcohol induced habit. One kidney gallbladder hypertension. This is the gallbladder hypertension. Why we are called it as a gallbladder hypertension? Because the kidney in this, the one kidney is removed, and we a person is only on one kidney, and this one kidney is not strong enough to support the blood pressure of your entire body. So there's a difficulty in a blood pressure or a hypertension maintenance level. If the person, when one kidney is removed and a constrictor is placed on the renal artery of the remaining kidney, constrictor which constricts the venule or constrict the airway or passage from which the blood is entering into the kidney. When we constrict this, automatically blood pressure increases. The systematic atrial pressure begins to rise and continues for several days after the removal of one kidney. When our atrial pressure reaches its new stable pressure level, the renal arterial pressure backs to normal. This condition is only for the few beginning days or for several days after the removal of one kidney, but it will normalize gradually as the time passes. A new stable pressure level will be obtained. So the renal artery pressure back to the atrial pressure back to normal. Kidney, the pressure which is in bear by the kidney become back to normal, and the person is again moving towards a healthy life. The hypertension produced in this way is called a one gallbladder hypertension. The second type is two kidney gallbladder hypertension. In this, when there is an stenosis of a single renal artery caused by atherosclerosis. What is atherosclerosis? This is an artery, suppose, and there is atherosclerosis, the accumulation of fat which blocks the artery. Whenever the atherosclerosis is produced in the arteries, and the person having a two kidney, so it also may suffer from this hypertension. Why? Due to this atherosclerosis, which is accumulation of fat inside your arteries and inside your veins of blood flow. The constrictor kidney secretes renin. The kidney, suppose this is a kidney, this is the one kidney, and this is another kidney of yours. This kidney takes atherosclerosis plaque in this way, so it secretes or start production of renin. Renin will be secreted by this kidney. Due to the increasing blood is not reaching this kidney, so this kidney wants to increase the blood flow, so it starts secreting renin, which cause increased blood pressure or load over this and automatically on the another kidney. And the retention of salt and water due to renin, as we know that renin accumulates or retains sodium and water, so due to this volume is increases. Due to the increase in volume level, the kidney also damaged by this effect automatically. The renin cause formation of angiotensin. This is not enough at all. Okay, the person, if the person is suffering from this type of hypertension, the renin formation is start and increasing as the time passes. This renin will initiate angiotensin 1, and this angiotensin 1 will convert it into angiotensin 2 by the angiotensinase enzyme. And aldosterone, which is important for the kidney hormone especially, this is aldosterone. Thus both kidneys, but for different reasons, it can become salt and water retainers, and automatically whenever excess amount of salt and water retains, automatically blood pressure increases. So these are the phenomena of increasing blood pressure. This is the normal blood pressure of a healthy person, and this is the higher blood pressure patient's interior diameter of artery. This is the healthy person, the diameter. You can check this here. The diameter is very thin. Here you check, this diameter is very thick. As a person is suffering from hypertension, the diameter increases as thrice or twice of that normal person through them. So the blood as passes, it increases its pressure automatically. Why? Because the area from the passage is decreases. So the person is from hypertension may have this type of arteries or venules, and the person is normal is having this type of flow and this type of effect. So there is a accumulation or the clump of blood flow, and there the blood flow is normal, blood flow is slow, blood flow is on normal conditions. What is a hypertensive emergency? A hypertensive emergency is a high blood pressure with the potentially life-threatening symptoms and sign. Whenever there is a hypertensive emergency, a person may death. This is the sign or the symbol of death, indicating that your acute impairment of one or more organ like brain. If your brain may be damaged, your eye may damage, heart may damage, aorta or kidney may be damaged due to this hypertensive emergency. The blood pressure shooting its maximum tolerance level. So this hypertensive emergency cause all these organs to be impaired and causing death, life threatening effect. What is the treatment order? If yes, if you have a symptom of hypertension, then you cause it as an emergency. When you have no symptom of this hypertension, you call it as urgency. For urgency, you need these drugs to be treated, like IV labetalol, IV metoprolol, and IV hydrolysine will be required for the treatment of hypertension. But for this hypertensive emergency, in this emergency, you don't have a chance to take these drugs because they take time. So you directly comes towards these emergency condition, that is nitroglycerin. These are nicardipine, these are beta blockers, nitroglycerin. These all are immediate affected drugs which produces effect immediately without any delay. If your current blood pressure is greater than baseline blood pressure, then if yes, you can treat it by these. If no, then immediate treatment will be required if you are suffering from hypertensive urgency. What organs are targeted? The targeted organs involved are most probable and the most especially is the brain, heart, retina, your eye, retina, and kidneys, your kidneys. You may affected or get damaged by hypertension of all these organs. Emergency versus urgency, as we have discussed, it's a condition of emergency in which a high blood pressure results in target organ damage and may lead to death. Emergency versus urgency. Urgency is also a severely elevated blood pressure level, but there is no evidence or no symptom of damaging or no symptom of blood pressure increasing. In this, systolic blood pressure is greater than 220 millimeter of Hg. We automatically recognize that we are suffering from urgency, and if our diastolic blood pressure is greater than 120, we also recognize automatically that we are urgency patient and we have to treat this by going through specialist or any patient doctor. What are the drugs of choices? There are many drugs of choices. We are only names them here. Why? Because in the next slide we're going to discuss all these in a very detailed through. Okay, so the drugs of choice in treating patients with a hypertensive crisis and eclampsia and preeclampsia. Pre means before, eclampsia means after. If a pregnant woman is suffering from seizures, and if it is due to the absence of oxygen, a pregnant woman is suffering from eclampsia. So this eclampsia is in pregnant women's seizures or convulsions. Okay, in this, due to the less amount of oxygen or due to the metabolic alkalosis or due to the fetus alkalosis, these conditions are occurs and cause seizures. Hydrolysine, these drugs of choices are also used in eclampsia or preeclampsia conditions. Okay, hydrolysine, labetalol, and nicardipine 5 or 6 indicates its levels. Angiotensin converting enzyme inhibitors, we are giving angiotensin receptor blockers. We have discussed direct run inhibitors. We discussed sodium nitroprusside are contraindicated in treating these patients. This is only presentation. This is an only presentation of hypotension. Hypo means the heart is extremely tired or energy less or flaccid. Why? Because the oxygen level is very low or to the level of negligibility. Whenever it is to 90 to 60 millimeter of Hg, the heart may suffer from hypotension, means decreased oxygen level, and this is also another dangerous condition after hypertension. This hypotension is a low blood pressure level in which the organs like our kidney, like our heart, and many other important organs will starting to fail and faint due to the less oxygen supply and less blood flow. This may result in stroke, heart attack, kidney failure, and bowel ischemia. Bowel ischemia means irritation or absence. Decrease the blood supply to the small and large intestine, which may affect your digestion and intestinal flora. Shock deteriorates are the end result of prolonged low blood pressure. Whenever the person is extremely suffering or extremely facing a low blood pressure level, then the shock and deaths are the end results. What are the precautions? These are the precautions you must have to acquired or adopted. If you are hypertension patient, or if you see some hypertension patient, then you may precause that you that should drink more water and increase salt intake in case of hypotension, means low blood pressure level. Okay, these are the normal heart sounds related to blood pressure. It is not concerned with that hypertension or hypotension, but as we are discussing blood pressure, so these sounds are very important to discuss in this slide. These are we call the Krotokoff sounds in a biological term. The Krotokoff sounds are the noises that can be audible. There's a stethoscope, we place it over the hair. This is an inflatable cuff or inflammable cuff which is wrapped over the arm. So these give this apparatus, which is called stethoscope, give the Krotokoff sounds. We having four phases of Krotokoff sound. The first sound, whenever we are listening, this is a diastolic. This is a clear tapping tone, and phase 2 is a softening of the tapping and a squishing element, and phase 3 there's a sharp noise will be heard, and abrupt muffling of sound follows by phase 4. After that, no sound will be heard. Why? Because the arteries are blocked. These are arteries and these arteries are blocked, so no sound will be heard after this sound. Causes of Krotokoff, why the sound can be heard. These are the underlying. Whenever the underlying artery is collapsing, mean this is the artery, this is the opening. Whenever this opening collapse, means this like this, and then the reopening, this is the collapsing stage, and this is the reopening. After this stage, it becomes again to this stage opening. Their sound, two sounds will be heard, and these are basically called dub and dub sounds, and we are also stated as heartbeat. So these sounds are the result of fluid turbulence or the results of atrial wall oscillations. So that's all for today. Thanks for watching. Please do subscribe and share to motivate me and my team. Stay blessed.